Hello. Welcome to Emmi. Now, you're here to learn about getting the flu vaccine. Of course, nobody likes getting the flu, and yet every year most people do not get the flu vaccine, which means every year people still get sick with the flu, miss days of work or school, or worse, they spread the flu around, getting everyone else sick. But you can usually avoid getting the flu, and the flu vaccine is the best way to protect yourself. That said, there are some people who really need to get the flu vaccine every year. This includes anyone with a chronic health condition, like chronic lung disease, diabetes, or heart disease, pregnant women, small children, and anybody who cares for small children, the elderly, and people who are at risk, which means anybody working in or going to crowded, busy areas, like a superstore or public transit. If you live in crowded areas like dorms or military barracks, students, teachers, or anyone else who works at a school, nurses and other healthcare workers, family members who regularly visit nursing homes, anyone living with young children, anyone caring for or visiting someone with a chronic health condition. In fact, the flu vaccine is recommended for just about everyone. Of course, you want to check in with your doctor's office or local clinic ahead of time, because they can tell you if the vaccine's available for you, and they can make sure you get it before flu season hits, which is key. Now, it's rare, but there are a few reasons why some people should not get the flu vaccine. Of course, most people get the flu vaccine without a problem. But if you've ever had a true allergic reaction to the vaccine in the past, I'll talk more about this later, but if you've had an allergic reaction, you definitely know. Or if you have a severe allergy to chicken eggs. Or if you have a history of something called Guillain-Barré syndrome, or GBS. If you have this, you know what I'm talking about. If you're currently sick with a fever, you should wait and get vaccinated later. But even if you've had a bad reaction to the flu vaccine, talk with your doctor. Because the vaccine is always changing. Something that caused a bad reaction 5, 10, or 20 years ago may not affect you now. I hope you found this information useful. Thanks for watching. I wish you the best of health.